Hi, I'm Dr. Sreekanth Vemula. I'm a neurologist. So the second important complication which people are worried about is impotence. They're not able to perform sexually. That's because the nerves which supply the sexual organs are not working very well. So they're unable to have an erection or perform sexually. This worries them a lot. They're not sure what's happening. Sometimes it happens in the early stages of diabetes also. For example, in the early stages where there is pre-diabetes or insulin resistance stage, they have impotence, which makes them very worried. But you should understand that control of diabetes and with certain medications, this can also be taken care of. Some people have a decreased motility of the stomach. The stomach doesn't move. So there is a fullness. As soon as they eat food, they have a fullness of the stomach. And sometimes they can't pass stool. It's called constipation. Sometimes they have diarrhea. So all of these can be because of involvement of the gastrointestinal system because of diabetes. And sweating abnormalities. Some people, when they eat food, with some diabetics, when they eat food, they're sweating all over their head. That's also because of diabetic neuropathy. Apart from this, when the neuropathy goes untreated and the diabetes goes unchecked, it can progress. They lose sensation and they can't walk normally because of a lack of sensation. Sometimes when it's very severe, the feet become weak and so they cannot wear slippers. They lift their feet off the ground and walk like a stomping gait. So all of these things happen when the diabetic neuropathy is allowed to progress without being treated. What does the patient do? The patient goes to a neurologist. The neurologist checks the patient, confirms clinically that there is a neuropathy, and then does a procedure called nerve conduction study, which tells us what is the type of neuropathy, how severe it is, and what can we do for that. Apart from this glove and stocking type of neuropathy where the feet, the legs and the hands are affected, there are other types of neuropathy which can happen in diabetes. One is called a carpal tunnel syndrome. When people, some of them, they sleep, the hands become numb. That's because the nerve at the wrist gets pinched and the fingers get numb. And also when they hold objects or when they carry heavy stuff, the hand becomes numb. This numbness is because of median nerve compression at the wrist. It's called carpal tunnel syndrome, and if it is detected, it can be treated easily. There is another condition, painful condition, where the thigh becomes numb. It's called neuralgia parasitica. Before it becomes numb, it becomes painful. So this condition is again detected by testing the nerve, confirming it, and treating it. It's also highly treatable. Similarly, some patients have a pinching of the nerve around the knee that causes them to have a foot drop, where they cannot lift their foot off the ground. This also can be treated. So, as we understand, there are several such conditions which affect the peripheral nerve. Sometimes they affect the nerves from the head and neck, the cranial nerve. So, some diabetics start seeing things double. There is only one thing, but they're seeing two of them. That's because the eye nerves don't coordinate. There are two sets of eye nerves. If both of them talk to each other and coordinate, it's fine. If they talk differently, then they move in different ways and you start seeing double. Either a third cranial nerve or a sixth cranial nerve weakness can do this. But that is temporary. It doesn't last beyond 2 months. Once it's identified, a lot of fear is taken care of. Otherwise, people are worried. Has something happened inside my brain? Do I have a tumor or do you have a aneurysm? Any of these fears can be there. But once the doctor sees and identifies that it is a diabetic third nerve or a sixth nerve palsy, it's easily taken care of. And people recover completely in 2 months' time. So that reassurance is needed with a proper understanding from the doctor's side. So as you can see, most of these neuropathies are treatable and some of them, of course, have a chronic course and may not respond fully, but many of them are treatable. So once you consult the proper doctor for this, they will identify, treat, tell you to control your diabetes and make you have a pain-free, relaxed life. Thank you so much for watching this. Please subscribe and follow if you like this video.